Patients receiving home care services are often housebound, making focused on-site wound assessments critical to improving healing outcomes. While wounds are assessed and treated in a standardized practice by wound presentation in response to treatment care plans, there's little consistency in addressing contributing factors that may adversely affect healing in these patients. This translates to inconsistent care coordination, which can delay ancillary care services or have referrals missed entirely, jeopardizing patient outcomes. The project's PCODE question is in adult home care patients that are admitted to home care services with a nutritional risk score of a moderate or high risk. How does the incorporation of a triage care coordination algorithm impact care access to resources over 4 weeks compared to patients not receiving a triage care coordination algorithm for resource care access? The project design, Wound Care Champion RNs performed admissions to prospective patients and implemented the triage care coordination algorithm workflow. All home care patient referrals were screened for those meeting project patient criteria and scheduling with the Wound Care Champion RNs. Also, performing an assessment of patient project participants and non-project patients. Determine home care agency response and receptiveness to workflow change, and addressing patient satisfaction and care coordination and timeliness. The results of non-project participants, 3 out of 20 had social working services by 4 weeks. Only 1 out of 20 had received a dietitian. 19 out of 20 had provider services by 4 weeks, and 13 out of 20 had labs by 4 weeks, only 4 of which were project-specific labs. Patient project participants had a 50% in uptake of social working within 2 weeks. 50% had not received provider response for orders in this time. 100% provider follow-up within 2 weeks, and 75% had labs drawn within 2 weeks, with 25% not having provider response. 50% of the labs drawn were project-specific labs. Project threats and barriers and tactics used to overcome and facilitate. The CMRN enrollment, or the clinical management RNs, to the QI project was slow and conservative. A pre-invitational email sent prior to formal clinical project introduction email was sent out. Follow-up email was also provided 3 business days after project introduction. Individual calls were made as needed for checking in and Q&A. Patient project participant enrollment was slow. Patient project participant age criteria was increased to aged 18 to 85, and check-ins were made at the intake referral RN. And lastly, staffing is challenging. Non-scheduled days were worked by project lead to increase the number of prospective admissions screenings, and Wound Care Champion RN volunteering to pick up. Thank you for your time.